Hello everyone. Today we're going to talk about why our gums bleed. Many of us believe it's only because we're not brushing correctly or we simply didn't brush our teeth. Then what is going to happen is interesting. We're going to see, this is called gingivitis, and is when you're not brushing every day and your gums start getting with some inflammation. You don't brush for weeks, and what is going to happen? Calculus is going to be around your tooth and it's going to destroy the bone. And by the time you see this part gone, most likely these people will lose the teeth, not because they have caries, not because they have a problem like this, but because now the surrounding tissues like the bone that is here is going to be affected. Periodontal disease, unfortunately, affects in highest percentage the population. United States, of course, in other countries. And many of that is because, honestly, if I wasn't a dentist, I wouldn't know what to do. But now, since I take care with the correct toothbrush technique and flossing, and I can use if I want to use water pick and everything else, but the flossing and brushing, there's nothing that can substitute that part for the cleaning of your teeth. So when you look at this part of this tooth and these molars will be completely gone because the patient wasn't brushing, it's not only the bleeding. So this is one of the reasons, but sometimes it's hormonal. In this case, the patient, imagine all the accumulation of calculus that is here, and still, when you're removing this, the bleeding is going to continue until this patient comes in the routine more and more and more, that is not going to have any more bleeding, and they're going to look very healthy, the gums, like in these different patients. And what is going to happen, that my advice to you is, you sometimes have, I have another image that I wanted to show you, where we have a patient that going to menstruation, a period in a woman, is going to cause inflammation similar to this one, and it's going to be around all the mouth. So the patient is going to have to be more careful on the brushing and flossing because the gums are going to be very affected. And related to the gum disease, then what is going to happen? Exactly the same thing when a patient is going through hormonal changes. It's also the same. The patient is pregnant. During pregnancy, the gums are going to be very, very inflamed. So if the woman is pregnant, it's very important that she comes to the dentist, the patient comes to see me and is having a toothache. I cannot take x-rays, and I take advantage. I try to remove as much as I can with the safest procedures. And then I see the gums are extremely inflamed, and they didn't know it's hormonal changes due to pregnancy. So I go over again the technique, and following that brushing and flossing, they're gonna be a lot better. Teenagers also, when they are going through adolescence and their hormonal changes, whether it's a boy or a girl, are gonna have the same problem. So you're gonna have to be careful. So remember the reasons. One is because we don't brush and floss, like in the patients I showed you before, and then accumulates an excessive amount of calculus that is going to destroy not only your gums, not only your tooth, but also the bone of your teeth. And the teeth, once the teeth are without the bone, then there's nothing we can do because it's not going to be support, and then all of a sudden your tooth is going to be falling out of your mouth. And the other is hormonal, so it's simple as like this. You brush and floss every day, and your gums are not gonna be bleeding. Also, if you scrape your gum with a piece of bread, that could be another. Or if you're brushing really hard and you scrape with a brush, and then your gum can be bleeding, but that is temporary. But if your gums continue having some type of bleeding, you have to see your doctor and check. If you don't feel a bump on that tooth, that could be the cause of an infection, whether it's because of your gums, or it can be like the case I showed in the last episode that has an infection. All of that, go to your dentist, get the education that you need, and you're gonna be a lot better. Or better yet, remember this channel is about creating a dental-free treatment, which is no treatment. So you can subscribe to my channel, Dr. Fanny Yacaman, and put a like if you want it, and follow in Instagram and TikTok. I hope you like this topic. Take care.